morning, good afternoon, and good evening. Welcome to the 22 day 1022nd of continuous uninterrupted Zoom session of Ifph. Let us start today's program with a silent prayer for a minute. Thank you. Today we have with us Dr.K.A Shalini, B.H.M.S, graduation from Government Homeopathy Medical College, Bangalore, 2009. Certificate course in Children Health, CGH. Certificate course in Gynecology and Obstetrics, CGO. Certificate course in Skin and Venereal Disease, SBD from BIMT, Pune, Maharashtra. Physician, duty doctor, Homeopathy Charity Center, Bangalore, Nisarga Clinic, Bangalore, Karnataka. The topic is homeopathy treatment for uterine fibroids. The prevalence is very much and the possibilities are there. So it is up to the homeopathy physicians to have some strong presentations and actions to treat such cases, uterine fibroids. On behalf of Ifph, I welcome Dr. Shalini. You can have the platform for the next 45 minutes. It's over to you.
Hello, everyone. Is I audible?
Yes, please.
Yeah. Hello, everyone. So thank you so much for such a wonderful opportunity you're giving me to present a case on uterine fibroids. Now I'll be sharing the slides. Yeah. So today we are going to discuss about the uterine fibroids that is very common in our day-to-day practice. In our day-to-day practice, we'll be seeing the one or the two cases daily, which is very common in our day-to-day life. So first, we'll know the definition of uterine fibroids. So the definition of the uterine fibroids is it is a leiomyomas, that is, it is a non-cancerous tumor or it is a benign tumor, which is not cancerous form and it will not spread to any part or organ of the body, which originates from the smooth muscle, that is the tissue which is present inside the uterus, that is the myometrium. So simply if we understand what is uterine fibroids, means it is a benign tumor which forms inside the uterus of a female. So it is very common in day-to-day practice, because due to lifestyle changes, dietary changes, and hereditary and sedentary lifestyle, we are seeing the uterine fibroids very common in our day-to-day practice. So now we have studied about the definition. Now we'll see the types of uterine fibroids. So there are mainly 4 types of uterine fibroids. As you can see in the diagram, see here you can see the vagina, cervix, and the uterus, the uterine cavity, and there are 4 very important types of uterine fibroids. In the diagram, you can see intramural, subserosal, submucosal, and the last one is the stalk which is present in the uterus, that is called the pedunculated fibroids. See in this diagram, you can see very clearly. You can see the vagina, cervix, and the uterus, and the uterine cavity you can see, and you can see intramural fibroids, submucosal fibroids, subserosal fibroids, which is the benign fibroid, means it will not spread to any organ, or it is not a cancerous form. Now we'll see the first one is the body or the corporeal fibroids, that is intramural or interstitial fibroids. Both are same. See in the diagram you can see. And the second one is subserosal, as I have already told. And next is the submucosal fibroids. So these are the types of fibroids which is formed inside and outside the uterus, which is the benign form. Now we'll see each types of fibroids, its location. So there are 4 main types of fibroids based on their size and location relative to the uterus. As I have already told, the first one is intramural fibroids, subserosal fibroids, submucosal fibroids, and pedunculated fibroids. So each one is explained below with their location. The first one is what are intramural fibroids, means what is intramural fibroids. It is the most common type of fibroids. You can see in the diagram. intramural fibroids. It is the most common type of fibroids, grow in the wall of the uterus. They may eventually enlarge to distort the uterine cavity or the serosal surface. So intramural fibroids are the most common type of fibroids which grows in the wall of the uterus. So you can see here, it grows in the wall of the uterus. I think you can see here in this very clearly. See these intramural fibers which grow in the wall of the uterine cavity, and it is the most common type of fibers which is seen in our day-to-day practice. And the second one, means intramural and the transmural fibroids are the same, that extends from the serosa membrane to the mucosal surface. So intramural fibroids and transmural fibroids are the same, which extends from the serosa membranes to the mucosal surface. And the next one is the subserosal fibroids. You can see in the diagram, this is the subserosal fibroids. Which grow on the outside of the uterus. As they grow larger, they can cause pain due to the size and the pressure that they put on nearby organs. As subserosal fibroids grow outside the uterus, and when the size increases, when it grows in the size, it will cause pain due to its bigger in size, and the pressure is formed so to the nearby organs. So these are called the subserosal fibroids which grow outside the uterus. So intramural fibroids grow in the wall of the uterus, and the subserosal fibroids grow outside the uterus. So this we can remember. And the next one is the submucosal fibroids. In the diagram, you can see submucosal fibroids. They just grow just underneath the uterine lining and can crowd into the uterine cavity, leading to heavy bleeding and other more serious complications. So these submucosal fibroids, they just grow underneath the uterine lining, and they can form a crowd into the uterine cavity. And the main symptom any patient comes to us is with the heavy bleeding. And due to heavy bleeding, it can cause other more serious complications like anemia, it can cause, and like a hemoglobin may fall. So due to heavy bleeding. So these are called submucosal fibroids. And the last one is the pedunculated fibroids. They grow on the small stalk inside or outside the uterus. You can see in the diagram. See in this, you can very clearly see the stalk, like hanging kind. So these are pedunculated fibroids which grow inside and outside the uterus, and they grow on small stalk, that is the hanging, and they are thought to cause episodes of acute pain, and they may twist, and when there is a twist or contort, it will cause episodes of acute pain, and it will cause pressure on the adjacent organs also. So these are the 4 types of fibroids. So when any patient comes with the symptom of heavy bleeding in our practice, first we have to advise her to go for USG abdomen, that is abdomen scanning. And in the abdomen scanning, the report will show the fibroids, its size, and what kind of fibroids are seen. So in the USG abdomen report, we can find out, and we can give the treatment according to the type of the uterus. Depending on the type of the fibroids. Next, we are seeing, so when these uterine fibroids are formed, what are the causes or the etiological factors which causes fibroids in females? The first one main is the physical activity, means the lack of physical activity due to the sedentary lifestyle. Okay. Etiological factors, the first main is the sedentary lifestyle and lack of physical activity. Like nowadays our work, our habit has become so lazy, we go to shops in a 4-wheeler, and we don't use any lifts, so we are using lifts and we are not using staircase. So due to lack of physical activity, and there is no exercises and sedentary lifestyle and overweight, when the body mass index is more, these are the risk factors which may target to form uterine fibroids. And the next one is the dietary changes. Like nowadays, we are more dependent on the Western lifestyle of diet, and we are not eating the breakfast properly, and the food does not contain any nutrition proteins, and we are just going on any fried items or any outside food which does not contain any nutrition proteins, lack of protein and lack of vitamin, and lack of uh, improper take of diet, like breakfast is missed, or the lunch is missed, or the night they don't have food, or the food does not contain any vitamins. So dietary changes also contribute to form the fibroids. And next one is the hormonal imbalance. And when there is hormonal imbalance, and when there is lack of physical activity, and the diet is not taken properly, and lack of sleep also, these are the condition which contributes to the hormonal imbalance also. So hormonal imbalance also is the main cause for uterine fibroids. And the next one is the age. So uterine fibroids is seen in between the age of 19, 20 years to menopause, and when the menopause is also not attained, and when there is the age above 55, 58, and there is also heavy bleeding. They will be having uterine fibroids. So when they come to our when they come to our clinic, we have to advise them to go for USG abdomen scanning, and we have to find out like for what reason she's having heavy bleeding. And the next cause is the race and genetic. And when there is a genetic disorder or hereditary may cause the uterine fibroids. And when the endocrine disruption is there, and as I have already told, lifestyle changes also causes uterine fibroids. And the risk factors is genetic factors, I have already told, and extra weight. And when the female takes lots of birth control pills, and when there is early onset of periods, like menarche is attained at very early age, like the child when her age is 10 years or 8 years and 9 years, and when she attains menarche early, and in some cases early onset of periods may also cause fibroids in the later age. And alcohol, and when there is vitamin D deficiency also, and diet low in fruits and vegetables, when the patient is not taking a diet which is rich in fruits and vegetables, these are all the risk factors which causes uterine fibroids. Next, we'll study about the signs and symptoms of uterine fibroids. So what are the symptoms of uterine fibroids? And when a patient comes to us, what is the main, the symptom is the heavy menstrual bleeding. When she comes like in a month, when she experience like 7 days bleeding, and after 15 days also there is spotting. So the like menorrhagia symptom may be there. Menstrual periods lasting more than a week, like as I told, like when the menstrual periods last more than 7 days, and when there is a pelvic pressure or pain, and when she complains of frequent urination, because when the fibroids it gives a pressure on the urinary bladder, and she experiences frequent urination, and there is a pain or difficulty while emptying the bladder, and she complains of constipation also. Backache and leg pains are the most common symptoms which we see in the uterine fibroids. In this picture, you can see back, leg, abdomen pain, and there is a bloating of the abdomen as the fibroids are present, and there is heavy periods, and the complications is infertility and frequent urination. So the treatment or the management of this is like healthy weight has to be maintained by doing daily exercises, yoga, swimming, physical activity should be there, and alcohol limit should be less. When they we have to ask them like whether they are alcoholic, smoking. We have to advise them to stop or limit the alcohol, and medicine has to be taken. And in a very more complicated and very serious condition, the doctor may suggest for surgery depending on the type of the case or the symptoms. Next, we are studying about the risk factors only. Like as I have told, early onset of menarche means early onset of puberty. When the child, when she attains menarche very early age, like 8 years, 9 years, 10 years, and she is at a risk factor of uterine fibroids. And nulliparity means a female who have not married and who doesn't have any event of pregnancy at like 40 years, 45, and they have not attained the pregnancy, or when they are not married, they are at the higher risk of getting uterine fibroids. And obesity, like when the weight is more, and delayed onset of menopause. So when the menopause is not attained, 55, 58, 59, 60, and there is still bleeding, so we have to rule out like uterine fibroids by advising her to go for abdomen scanning and genetic factors. So these are the risk factors. Next, we'll study about the differential diagnosis of uterine fibroids. So when the, as I have already told, the symptoms and the signs of uterine fibroids, the same, like we have to rule out. So what is the differential diagnosis of uterine fibroids? First one is the full bladder. Second one is the pregnancy. Next, adenomyosis, bicarnuate uterus, endometriosis, that is chocolate cyst, and there is a chronic pelvic inflammatory disorder, ovarian tumor, endometrial cancer, there is a chronic inversion, and pelvic kidney. So these are the differential diagnosis of uterine fibroids. So we have to rule out. When the patient complains with heavy bleeding, there is a pain while passing urine, and there is a bloating of the abdomen. So we have to differentiate. We have to differentiate with these conditions. So now we'll study about the fibroids and pregnancy, like how the pregnancy can affect the fibroids. So in most common women, there is no effect of fibroids on pregnancy, and 80% remain unchanged in size. And there is a rarely rapid growth and red degeneration. There is increased risk of bleeding and threatened preterm delivery. So fibroids may cause the increased risk of bleeding and threatened preterm delivery, but most deliver at term only. Fibroid in the lower segment can interfere with vaginal birth. Myomectomy at the time of cesarean is not wise, and 30% require emergency hysterectomy. So effects of fibroids on pregnancy can cause, during pregnancy, it may cause abortion. There may be pressure symptoms. There may be malpresentation, retro displacement of uterus, and during the labor, it may affect in. It may cause preterm labor, malpresentation, uterine inertia, dystocia, PPH, MRP, and during after delivery, it may cause subinvolution, secondary PPH, and it may cause inversion, and it may cause puerperal sepsis. And next we'll see the complications of uterine fibroids. When the patient unaware, there will be heavy bleeding and she will not take the treatment, or when she doesn't go to any doctor, and what it may cause, the complication of uterine fibroids is, the first one is the thromboembolism, that is the obstruction of a blood vessel by a blood clot, and there is a twisting of subserosal pedunculated fibroid, and acute urinary retention, because those fibroids put pressure on the urinary bladder, and it may cause acute urinary retention, and it may further lead to acute kidney failure, then acute vaginal or intraperitoneal hemorrhage, constipation, and infertility, or the complications of the uterine fibroids. Okay. Next is the indication of surgical intervention for uterine myomas. Like just briefly, I'll just tell the points. So when there is abnormal uterine bleeding causing anemia, and when the hemoglobin drops to 654, and when there is severe pelvic pain or secondary amenorrhea, and uterine size is more than 12 weeks, obscuring evaluation of adnexia. There is urinary frequency retention or hydronephrosis, and there is growth after menopause, like menopause age is attained and then too she is having heavy bleeding, as I have told, and recurrent miscarriage or infertility can cause the surgical intervention for uterine fibroids. Next, we'll see the prevention and management. So for this, we have to advise the patient to take low sugar diets can reduce the risk of uterine fibroids. And the patient has to take foods rich in beta carotene, folate, fiber, vitamin C, E, and K diet like broccoli. And we have to advise them to take cabbage, cauliflower. It may reduce the risk of uterine fibroids. As this contains proteins and vitamins, it will act as a supplement. And we have to advise them to go for regular exercise accompanied by stress-free, like by doing meditation, yoga. We have to advise them. So as I have already told, diet, it should contain spinach, carrots, and fruits, vegetables. We have to advise them, and exercise has to be done daily, regularly. And habits like alcohol, we have to ask them to quit, and any stress means they have to do meditation, yoga. Smoking means they have to stop. And supplements, like we have to see whether any deficiency of iron, magnesium, zinc, and folic acid, and we have to advise them. And during menstruation, we have to ask them to take extra protection. Like when there is heavy bleeding, we have to advise them to frequently change the pads, and fluid intake has to be more. We have to advise the patient for the prevention and management of uterine fibroids. Now we'll be studying about the homeopathic case of uterine fibroids. The abstract of this case is the infertility. Infertility is a condition where the couple is unable to conceive after multiple sustained attempts of unprotected intercourse for at least 12 months. So uterine fibroids, as I have told in the definition only, are smooth muscle benign tumor that develop in the uterus, a female reproductive organ, and is one of the cause of female infertility. So complication of uterine fibroids is infertility. So now the case is about a case report of 32-year-old married female having having secondary infertility with uterine fibroid and had history of miscarriage. She delivered a healthy full-term girl child successfully within 11 months of treatment by a single homeopathic medicine, Sepia, in the potency of 30C and 200C with repetition as per requirement. For her, ultrasonography of pelvis was advised, urine pregnancy test was advised in the follow-ups, and the hematological and serological tests have been done to record the changes. Now we'll see the case, the patient information. A 32-year-old married female from middle socio-economic status family reported to our clinic in April 2022 with complaints of not conceiving since 2 years. Her menstrual cycle was regular, that is for 28 to 30 days cycle, flow lasting for 2 to 3 days, but scanty, associated with stitching pain in lower abdomen, and also complaints of pain in lower abdomen during intercourse since 1 year. History of presenting complaints. The history of the cases: she got married 8 years back, that is in 2014, delivered her first baby in 2016. She used copper tea after delivery, developed amenorrhea after using the copper tea, for which she took homeopathic medicine and got her regular menses with another doctor. Again, the couple tried to have the second baby, but she had miscarriage 2 years back. Thereafter, she could not conceive, for which she went to gynecologist and underwent an ultrasound of whole abdomen, and report showed uterine fibroids measuring 5.2 into 4.3 centimeters was seen in the fundus of the uterus. So when she came, she brought all these reports to me. So after the clinical findings and the diagnostic assessment, patient had like when I took the case, like we have to take the case in detail. The first one, the major challenge to us is when the patient comes, we have to take her to our confidence. We have to slowly build a bond so that she open up. So main our like we have to find out the mental generals. So in the first visit, we can't find out. During the follow up, we have to find out, and we have to tell her when she will be in her home, when she find any peculiar or any interesting simple like mentals or whatever, she has to write down in her one sheet. And when she comes for the follow up, those small things or the peculiar symptoms which help us to find out the homeopathic remedy. There is a constitutional remedy. So when I took in the first visit, when the first visit I couldn't make out, but in the second and third, like I can find out. The clinical findings and the diagnostic assessment is that patient had history of jaundice, that is 10 years back, and history of miscarriage 2 years back. Family history of hypertension of her father and osteoarthritis of her mother is seen. She's slightly dark. Her height was 155 centimeters and weight was 65 kgs with body mass index of 27.055. Patient underwent ultrasonography of whole abdomen. There was evidence of uterine fibroids of 5.2 into 4.3 centimeters was seen in the fundus of uterus when I advised her to go for again abdomen scanning. So the homeopathic generalities, mental generals, what I found out is she was very irritable and anxious about her problem. She was indifferent to family members, especially her husband. She preferred to be alone, and there was weeping, when she used to say about her complaints, she used to weep. So she has a symptom of weeping tendency. So these are the mental generals which I found out. And in the physical generals, she was dark and overweight. She had desire for sour and sweet foods and had aversion and intolerance to milk. She had increased frequency of urination. She had regular menstruation cycle was regular, 28 to 30 days cycle. Flow was scanty, lasting for 2 to 3 days, associated with stitching pain in the lower abdomen. On the basis of prescription, in view of symptoms like history of copper T insertion with amenorrhea, after that irritability, indifference, company aversion, desire sweets and sour, intolerance to milk, stitching pain in the lower abdomen, and menstruation was scanty, and there was sterility, scanty menstruation, and the sweating or the perspiration was also scanty. So patient started treatment and follow-up was done until urine pregnancy test was positive, and regularly monthly antenatal follow-up was also taken till delivery. So in view of the repertorial totality, like the patient started with sepia. So in view of repertorial totality, miasmatic analysis, and through consultation with the materia medica, individualized constitutional homeopathic medicine, sepia was selected as it got the highest score. This case was repertorized by using Kemp's repertory. Sepia covers sora, miasmatic, as this case has miasmatic background of sora, which made sepia to be prescribed. It was prescribed in 30 potency it was given for 2 times a day for 5 days, twice daily for 5 days. A single dose consisted of 6 globules of size number 20. So she was prescribed with sepia. It is a very beautiful remedy. Her mental generals, her physical generals, and overall sepia fitted properly. And when it was prescribed with 30 potency, and slowly her the symptoms were coming down. She used to come for the follow-up, no, like she used to tell that her we can find out that irritability was slowly decreasing, and her indifference to husband, like she was not speaking to her husband after the treatment was started, like those symptoms were it was showing in a very positive way. So sepia is a very good remedy, and this sepia has helped her, and the uterine fibroid size was also decreased, and she conceived also, and she was she went to the north India also, and she was continuing there also the medicine, and she conceived the second baby also. And so this case was very much treated with sepia. So sepia is the main remedy which helped in this case. um, so next we'll see the other effective homeopathic remedies which help in the uterine fibroids. The first one is the thalapsy bursa. So it is one of the top homeopathic medicine prescribed for uterine fibroids. It can be given in the potency form also and mother tincture form also for uterine fibroids with very heavy menstruation. It is given in cases where the periods are prolonged, frequent, and very discomforting pain. Uh, the medicine reduces this thalapsy medicine is very good, and it reduces the intensity of the symptom and provides significant relief from the troubles of uterine fibroids. And the next very beautiful remedy is the calcarea carb. It is one of the amazing homeopathic remedy for heavy and frequent periods, sometimes accompanied by vertigo also. We have to take the case thoroughly, the mentals and the peculiar symptoms, then only when this remedy matches the case, it will cure miraculously. In this calcarea carb, the troubles usually increase in increasing a tiring and straining day. In such cases, calcarea carb reduces the sharp and cutting pain of periods, and also elevates the feeling of heaviness of uterine fibroids. And the next beautiful remedy is the calcarea floor. It is most commonly prescribed. The homeopathic medicine calcarea floor is prescribed in the case of fibroids that are large and hard. Calcarea floor is the best homeopathic medicine for the treatment of multiple fibroids. It restores the elasticity of the smooth muscles in the uterus and helps shrink uterine fibroids. In addition to this, calcarea floor also subsides the pain and heaviness of the uterine fibroids. It can be prescribed in the potency 30C or 200C or 6X, 12X also. It will act wonderfully. So these are the main homeopathic effective remedies which can help in the uterine fibroids. So this is the case which happily today I presented. So over to you, sir. Thank you.
Yes, thank you, Dr. Shalini. Yes, nice presentation, and also, of course, we're all qualified physicians. They're capable of beautifully presenting, seamlessly presenting. That's the most important thing. Very fluently presenting, describe almost all necessary points. That's the most important thing, and it looks like homeopathy is the lone solution, the Hobson's choice in medicine for treating such cases. Otherwise, the surgery is the lone option. But we all know that it is not at all curative, but only gives some sort of palliation. It's time for discussion. Those who would like to participate can participate. You can share your experience, or you can add something to what Dr. Shalini presented. You said about this, started with investigations, different types of different areas it was there. The ultrasound, how far it is effective, or how much any other investigations needed or more in the recent times, or investigations of this uterine fibroids, Dr. Shalini?
Sir, when any patient comes with a symptom of heavy bleeding or scanty menstruation or anything, like we have to take her case, and first the investigation processes, we have to advise her to go for abdomen scanning. That is the main, and we have to advise her to go for thyroid profile test also to rule out any hypothyroidism or hyperthyroidism. So USG abdomen scanning is the only main thing which helps to find out like what is the abnormality in the
Yes.
uterus or the ovaries, or any case of polycystic ovarian disease also, or any like kidney stones, or which it helps in the abdomen scanning only.
I think the physician must be very cautious when there is a history of family history of this uterine fibroid, isn't it?
Yeah. Yes, sir.
Yes, that's most important thing. Moreover,
Family history, genetic genetic disorder also it will cause, and family history also we have to take the case. Yeah, we have to
Then-
ask her.
then what about the prevalence of this condition in our society, this uterine fibroid? Do you have any data or information regarding that? The prevalence, how much cases or how many cases are there in our society, in India or in your Karnataka?
Sir, actually, uterine fibroids, like it is more common, sir. Like wherever or whichever area or any zone we go, in a day, 1 or 2 cases of uterine fibroids I have seen in my clinical practice. So prevalence is,
What about the age factor?
the age factor, it is usually seen from 20 years to 55, 58 during the fertile period also, and in the like 50 above 50 years also. Like it is usually more seen in nulliparity, sir, because I have seen like the nuns or the people like nuns who stays in the churches, like who are not married, and her age is advanced and she has not got any pregnancy. So when we screen, so fibroids are seen more in nulliparity women, and overweight, sir. Main is overweight I have seen,
Yes.
and overweight, sedentary lifestyle, and when the body mass index is more, uterine fibroids are more commonly seen.
Yes. Well, there are two questions. One is what hormone test for fibroids?
Sir?
What hormone test for fibroids?
Sir, yeah, for actually abdomen scanning is done, and hormonal assay one like they will do in the lab, hormonal assay test, like what is the hormonal imbalance, like oxytocin, uh, like we have to see those hormonal assay test is also done, sir.
Yes. Then another, how many size fibroids can be treated by homeopathic medicines? Size of medicine, the fibroid, which is available to medicine. Yes.
Sir, like we have to when the case comes, depending on the size, the homeopathic treatment will help at least to decrease the size, sir. Like how much ever the size is in the centimeters or like homeopathy medicine helps in, to decrease the size. And some thalapsy bursa and calcarea floor, it will help in the shrinkage of the fibroids also, as we have seen in many books. I have seen like it will shrink the larger size fibroids.
In your experience, up to what size you're able to produce with the medicine?
Sir, in 5.2 like as in my case, 5.2 size. It
MM or
has
CM? MM or CM?
cm, sir.
Yes.
Sorry,
So
5.2 centimeters.
yes, that's good.
5.2 centimeters in my case. It has decreased to 3.4, 2.2. Like it has decreased in size. Yeah.
Yes. How much time did it took?
Sir, it will take 1 year, depending on the case. Uh, 6 months, 8 months, 1 year it will take.
Yes. Another one is prolactin, TSH, AMH, testosterone, total CA 125 test needed. So suggestion given by Dr. Harinaran Prasad.
Yeah, so those tests are important, but mainly when the centimeters, the fibroids centimeters is very important, but hormonal assay is important, sir, because we have to see the prolactin level also, That is very important. And yeah, like thyroid profile also we have to see. The TSH level, T3, T4 levels are also we have to see.
Yes. Moreover, I think the presence of psychosis when you detect it, as a homeopathy physician, you must concern about that. What is your opinion on that?
Sorry?
The presence of psychotic miasm in a child, a girl child, when it was detected, at the earliest you must give some antipsychotic medicine. Otherwise, they are prone to develop all these conditions in the later life.
Yeah, like today in my case, sepia, the miasmatic was Sora. Like when the patient with another patient, when the patient comes untreated or unknowingly, like she'll be having the symptoms and she will not come to any doctor, and it will turn to psychosis, syphilitic, and the next syphilitic. So when she comes, we have to take the case and find out what miasm it will suit the case, and we have to treat accordingly.
There's another question: pituitary gland tumor role in fibroids. Yes.
Pituitary gland tumor role in fibroids. Like I have not encountered any such case. Maybe, but I'm not sure of it.
Okay. The rubella IgM.
Rubella.
Yes. The question is not complete, I think. What rubella IgM is in chat box. It's not clear. Anyway, the other thing when it is said by H.A. Roberts, the infantile colics, that often is an indication of psychosis. So when the child cries in early age regularly, you must suspect it is a presence of this psychotic miasm. So at that age, you must give some medicines. Otherwise, in later life, they are prone to develop. Then certain diet and regimen, that is very important, especially the high fatty diet. Then the animal proteins, containing animal proteins, especially meat. The most important thing to develop this uterine fibroid.
Yeah.
The lack of exercise you just informed. Moreover, I think the stress is the most important factor, because nowadays the ladies are more ambitious. As the education is the level of education is improved, the physical quality of life index is gone high, and all other things came together. They are become more ambitious. They're always competing each other. That is also leading to this development fibroids. Dr. Shalini, what's your opinion on that?
Yes, sir. I have like a day in my practice. I'll be getting many females who are of housewives also, and who are of working women also, and they have lots of stress level, like family issues or the personal issues. And this, as you told, there's something like I want to become more like that. Competitive thinking is also there, along with it sedentary lifestyle and like a Western lifestyle, food intake, dietary changes. These are also causes uterine fibroids. Along with the main is genetic hereditary. Like uterine fibroids are caused in females.
Yes. Then we must think about the complications of the surgery. This fibroid surgery, the hysterectomy, and after removal of this fibroids. What is your opinion on that?
Yes, sir. Surgery intervention is seen when there is heavy bleeding, and with the medicines also, when the heavy bleeding is not stopped, and when the hemoglobin levels drop to 4, 5, 6, and when there is a like advice of blood transfusion is seen, and in that case the physician has to like they have to take a second opinion of hysterectomy has to be done, or the surgery intervention of removal of leiomyomas, or the physician has to think over. But like when with medicine also, when the fibroid size is increasing in size, and it is not due to other disease when the patient has, with other complicated case when the uterine fibroids, that individual is not being helped in the with the medicine, then the physician has to take a second opinion of surgery, like it has to be done or not, he has to take the opinion.
But often what happens is that I think the thyroid gland diseases are increasing after surgery. It's often happening.
Yeah.
Did you notice that?
Yes, sir. Yeah, after surgery, like the patient may go to hypothyroidism or hyperthyroidism. That is where like the TSH level may increase or the T3, T4 may come down. So after surgery, like I have seen, like with other doctors' treatment, when they come, they have developed the thyroid, like hyperthyroidism or hypothyroidism after surgery. Also, I have seen. Yeah.
Joseph sir is here. Sir, what is your opinion on the presentation of Dr. Shalini and
Hello.
yes, please.
Hello, Dr. Shalini. Your presentation was very good. And
Thank you, sir.
one thing I would like to say is these are the medicines which I also used to give with the good results. And basically nowadays what we see is women below the age of 30, we see more PCOD.
Yeah.
And above the age of 30, we see more fibroid uterus.
Yeah.
And I would like to know your opinion about Oramure nitrate, which is given boric materia medica as specific remedies for fibroid uterus.
Yes.
Well, I did not get much results out of it, but I would like to know whether anybody has got good results with that medicine in our group now.
Yes, Dr. Shalini, what is your opinion?
Sir, for me, like in my practice, as sir told, like even I have not seen much results with that remedy. I think for uterine fibroids, Thalapsy bursa and Calcarea floor, sir. Calcarea floor will, at least to some extent, it will help in the management of the case. But
No, all the calcareas help. All the calcareas help. Calcarea carb also.
Self also. Yeah.
And then some other remedies like Thuja, Lycopodium give good results.
It will
And also what I have seen is Lachesis is another remedy which gave good results. And sometimes the problem is people come with the bleeding and we have to control it. And the three remedies I have found useful is Avena, Cicalcor, and Lachesis to control the bleeding in acute conditions. And later go to the constitutional remedy or something like that. And the Lachesis is given when there is clots. There is clots.
Yes, sir. Lachesis, like as our main motto is that we have to take the case according to the mental generals. When the patient comes with Lachesis, the mental generals we have to take, and if the like constitutional remedy fit to that case, and it will definitely it will work.
And the mental condition of the patient is also very important, because what we see is usually we see women above the age of 35, 40 and having some kind of an antagonistic attitude towards the husband. That's a very important one. And also they feel that they are not, the children are grown and they are not appreciated properly, or they are left alone. Such a condition, Natramore worked very well. And as you all of you know that after Natramore, Sepia is the complementary one, which and the main miasmatic remedies are Madornum and Thuja. Especially Madornum comes when there is a history of recurrent urinary tract infections or some kind of genital infections in a way.
Yes, sir. That's right. And of course, Hariman advises us to give the antipsychotic medicines in tandem, one after another, especially Thuja and nitric acid, the interval of 10, 15, 25, and 40 days in chronic disease. Sir, Joseph, sir, what is your opinion, sir?
No, actually, during Haliman's time, the main psychotic remedies were Thuja and nitric acid. Madornum was not really there because the nosode came later on. So maybe that is the reason why Haliman did not mention about Madornum. But nowadays, what we see is many patients who had a history of recurrent urinary tract infections or some kind of genital infections, and also in hypertrophy of the prostate, where there is a history of some infections. Mador numbers very well.
Yes.
Actually, my opinion is Tuja and Madornum are better than nitric acid in a way. Nitric acid we see mostly in the action on the mucocutaneous junction, especially when people come with human papilloma virus or HPV, because nowadays people go for the gynecological examination and they find human papilloma virus.
Okay.
And nitric acid is found to be one of the best remedies to remove that, because people are more worried about this, because it is told that it is a precursor to cancer, and many people, especially in the higher financial strata, they go for checkup and come up with this diagnosis that HPV is there. Once they find that HPV is there, they are afraid that they will get carcinoma in future. So what their question is whether you can remove this HPV or not.
Yes.
But in many cases, I got good results with the nitric acid.
Yes.
Because the next gynecology examination may be after 6 months. And by 6 months, usually 80% of the cases are become negative in 6 months.
Yes. Sir, what about the potency? Is it target potency 200 or the centesimal scale or the LM potency? In your advice?
Usually the constitutional and the miasmatic remedies are given in the 200 and up.
Yes.
Because we want it to go to the deeper levels. You know, the constitution is the deepest level.
Yes.
Anyway, the presentation was good and the selection of the remedy was good, and the repetition and especially single remedy.
Yes.
Yes.
Congratulations.
Yes.
Okay, sir.
Yes.
Okay, sir. Thank you. Yeah.
Thank you, sir, for your kind words and words of experience. And of course, sir's father Isaac sir was a famous physician, and so that those Isaac sir has got an experience of around 60 plus years in this profession. That is why he is so fluently and effortlessly talking all these things. Am I right, sir?
Of course.
Yes, that's a major thing, because for the day one, we are always hearing all these medicines, belladonna, Axomegia, Causticia, sulfur, and all these things. From when the student comes from a homeopathic family or homeopathic background, at the same time, when he comes from another background, he don't have any idea. So he's around 20 years back. That's
It depends on the track you follow.
Yes, sir.
Or the attitude, you know, whether you want to be a classical homeopath or not.
Yes, sir, whether we are practicing this method or that method, we are being more familiar with this patient care, the method of case taking, or how to deal with all these things, they will get a definite edge. There is no doubt about that, sir. Because we know that the students in the colleges, they will get only a clinical exposure in the second year or third year. By that time, they will reach the age 20, 21. But when your father is or mother is a homeopathy physician, you will get information from the day one, isn't it?
But I think the problem is people or the students get become serious about this and the last phase of their study only.
Yes.
And that is the biggest problem.
Yes. Okay. Now it's Ahmad Hassan, sir. Yes, sir.
Sir, in
Good
the
evening,
chat
sir.
box.
Yes.
Good
Ahmad,
evening, sir.
yes, please.
Yeah. Dr. Isaac sir Majood and Dr. Shalini. My daughter, she's about 27 and student PhD. She just put some weight, yani, since about 2 years, yani. So what I can help her, because in my family all are normal weight. She's only just my youngest daughter.
Okay.
So if anything you can suggest.
So has she gone for thyroid profile test?
That I have done, it is okay. And I done all hormones also. Only prolactin is high. Just I have done yesterday. Only prolactin is high. Others are within normal limit. Yani, LH and FSH all are normal limit. So
Okay.
just a guidance, madam, if possible.
Sir, her like every month menses is regular?
Yeah. That everything is. She's with me. She's sitting with me. She's all right. Everything. She's very intelligent student. She's doing PhD in language from Delhi, Jamia Millia.
Okay. Okay. Her only this like her overweight is the like.
Yeah. Just now, since 2 years, she become some. And her height is 5'6" but now her weight is about 74, 75 nowadays. And previously she was 60, 62, okay. But since 2 years she increased about 7-8 kg. Yani.
Okay. Sir, her thyroid profile is normal and her menstrual cycle is normal, means with the diet and like diet and exercises, she can bring down the weight, sir. She has to do regular yoga asanas, she has to do meditation, walking, jogging, cycling, swimming. If she does, with this like exercise and the diet, she has to take like homemade food and she should not eat outside food. With this basic only, her weight will come down, sir. Any stress level is that she has to overcome by doing meditation. Stress-free life she has to be. Like any tension.
Yeah, thank you very much. By nature, she is sensitive, very sensitive. Okay, I will explain her. Thank you very much.
Okay.
And
Thank
very
you.
nice presentation. And since I am in pathology lab, so I enjoyed too much your all things. May Almighty bless you. Thank you very much, sir.
Okay. Dr. Shalini, there's a question. Is Ifph medicine safe during pregnancy? It's a question.
Yeah. Sir, sepia is safe during pregnancy. So there is no like interaction with pregnancy. They can take sepia.
It depends on the dose and
Yes.
Yes, sir. Correct. Depending on the dose, yeah.
repetition.
Yes, sir. That is the most. That is why Haniman in the chronic disease set in the material medical part. Whether you use how it's that's regarding the question on the arsenic album. You replied that either you can make a dagger or a plowshare with iron. You can kill a person with this dagger. At the same time, you can use it as plowshare. So depending upon how it used. That is the answer given by Haniman that time, around 250 years back. In his suggestions, and the diabetes patients and fibroids, another question.
Yes, sir. Like, see, diabetic patient with fibroids, like little risk, like when the diabetes is there, the fibroids, like we have to treat the diabetes along with fibroids, sir. Like the totality of the case, we have to take mental generals and miasmatic. Based on that, if the medicine is given, then it will help. Yeah.
Yes, okay. Now may I invite Hariharan sir to express a lot of thanks. Hariharan sir, are you there? Hariharan sir, yes. You can make your conclusions and what of
I have heard almost all suggestions and the class. Very nice. See, I want to say one thing, sir. Sir, everything Jose Isaac sir commented. But I like to comment, suppression is the main cause, one of the main cause for this fibroid. Suppression of emotions is one of the main cause of ladies for these fibroids. So we must address that. Then only we can cure the fibroid. The constitutional medicine, that is fine and fantastic for fibroid. I have cured a lot of cases by this constitutional medicine along. I will consider this is mental symptoms also. So we can cure the fibroid. That is not a problem for homeopaths to cure a fibroid. Okay, doctor, your class is nice and fantastic. and you are very young. See, after 10 or 15 years, you will become a very good gynecologist. If it is going this way, okay, thank you very much. Come
Thank you,
again.
sir. Thank you so much.
Yes.
Yeah, thank you, sir.
Yes, we all know that Dr. Hariharan sir is always enjoying the presentation of the young talented person, and he's always encouraging. That's why I always inviting Hariharan sir to express vote of thanks with us here. His heart is full with joy, filled with joy. I can see when hearing the presentation of the young talented persons. That's an important thing. With that conclusion, let me conclude today's English edition. Hope you to be the same time tomorrow. Till then, goodbye. And Dr. Shaila to continue the program in Malayalam.
Thank you, sir.